Have you or someone you know ever undergone a surgical procedure that required an extensive recovery time? Many times, surgery can leave patients dealing with weeks of recovery that require time off from work, as well as any other physical activities. How exciting would it be if doctors could shorten or nearly eliminate the recovery time altogether? This may seem like a distant dream, but it may be closer than you think. Current research has found that this can be achieved using an injectable two-stage medical treatment. But before we detail the drug delivery system, let's examine Perthes disease. Perthes disease is a condition usually found in young boys where the femur head's blood supply is inadequate. This results in necrosis of the bone tissue. Little is known about the disease, and many treatments require extensive surgery. If left untreated for too long, patients are likely to have a deformed hip joint and be much more susceptible to osteoarthritis at an older age. Fortunately, new methods of treatment are being developed.
So this originated from a discussion with an orthopedic surgeon. It's a pediatric orthopedic surgeon appointed between UK and the Shriners Hospital out on Richmond Road. And he sees these kids with Perthes disease. So they end up with this condition that is life-changing. It's not just painful, but it is a destructive disease to their hip. They have major problems, and many of them need total joint replacements way too young. So he was saying, we really don't have any good treatments for them. There are non-surgical treatments, there are surgical treatments, and none particularly work well. So he wanted to see, is there something that we could do, something that we could deliver into that femoral head, ball of the leg, and see if there's a way to prevent some of that destruction.
It works by injecting an anti-resorptive drug followed by an osteogenic drug in a timed-release manner that maximizes the benefit of the drugs. Basically, this means one drug helps rid the body of necrotic bone tissue, and after that, another drug helps the body regenerate healthy bone tissue. The drugs being used are not new, only the form in which they are being delivered. It is a two-stage system in an injectable liquid form.
The approach is like a sponge. So you take the gelatin and you cross-link. Everybody's familiar with Jello. Everybody made Jello. So we just warm it up and it dissolves. We don't want that to simply dissolve because then the drug is just going to dump out. So we essentially cross-link it. So you make covalent bonds between the chains so that it doesn't really matter the temperature and within a physiological range at least, it's going to stay as an intact microsphere. And then we just treat those particles as sponges. So we dry them and then just let them absorb the drug-containing solution. So like taking a sponge, putting in water, and they swell. They absorb water into it. It's just that when our gelatin microspheres swell, they pull drug in as well.
The first drug is suspended in the liquid to stop the bone from deteriorating, and the second drug is in the microspheres to encourage bone growth.
So that's why we wanted the anti-resorptive early, trying to stabilize the bone structure to some extent. And then after you give a few days for that to stabilize, then allow the drug, the simvastatin, the osteogenic, the bone formation promoting drug to start coming out. A needle going into bone, but you're not opening somebody up to do it. And then you have all that, sort of the human side, the pain and rehab, but also the cost of